Welcome to the Openminds Podcast, a space where we reflect on our emotions, our minds, and the way our experiences shape us and who we are today. This podcast is brought to you by mental health professionals who are dedicated to breaking through mental health challenges, looking at relationships, and also looking at developing our own personal growth through meaningful conversations and expert guidance. My name is Sakshi Kaur, your host for this podcast series, as well as a clinical therapist. And together we will navigate through the complexities of the human experience through perspective, knowledge, and understanding. Let's begin. Today we're going to be speaking about something that is very personal, but it's also very universal. It's all about the childhood scars that we have and the trauma that we all carry. And today we have a very special guest. We've got Syeda Batool, who's going to be speaking about childhood trauma with us. She's a DHA licensed psychologist who specializes in trauma. So Syeda, I guess I want to start off with asking you, why is this such an important topic? And I think for me, a lot of us struggle with self-worth, but we don't realize why and where it comes from. So why do you think this topic is very important?
Definitely, this is a very important topic and we should all take our time to address it. The magnitude of effect we have on our lives because of the traumatic incidents that have happened in the childhood, they carry on with us for the longest time of our lives. And so trauma, basically the word trauma, it comes from the word of wound. So it's basically an open wound that you're carrying for a long time. And obviously if you don't heal that wound, if you don't work on that wound, it's going to stay open for the longest time of your life. So for sure, we can't just leave it like that. Of course. We can't just let it heal with time. Like, how we say that wounds will heal with time and traumas will heal with time.
Yeah, we always say time's a healer, right? But
definitely. Time does play a role.
Yes.
For sure. It plays a role in decaying the memory. So there's no immediate triggers coming right your way. There's no immediate memories coming right your way. So that magnitude definitely gets less with time. But if you have an active trigger in front of you and your wound has not been healed or your trauma has not been healed, it's going to act in the very same way like it has happened just yesterday. Yeah. The triggers are going to be very fresh. The effect of those triggers are going to be very fresh. So it's very important that we address those traumas in a very healthy manner and we learn the coping strategies as to how we want to navigate our present life because of what something might have happened in the past.
I just wanted to add on, I think it's really wonderful how you explained what trauma is, and you mentioned it and compared it to like a wound when a wound is open. And something similarly when I see my patients as well, they all talk about this inner voice. Now, I want to ask you, what if this inner voice that we have, it's not coming from us? It's actually our childhood trauma and the scars that are speaking, right? What can you say about this concept a little bit?
So, like I mentioned, trauma is not an event that has happened to you. It is basically the effect of an event.
Yes,
right?
Absolutely, yeah.
So because of
the
that
aftermath,
effect,
really, right?
Absolutely. Yeah. Because of that effect, you keep that effect with you and you carry on with that effect in your later adulthood, with the rest of your life. And obviously that sometimes becomes a baseline for all your other judgment, your self-concept, for your life, for your decisions, everything that's going on with your life. So that inner voice that you're talking about, the inner voice, the part of healing is also this, that we have to identify that where is this inner voice coming from?
Yeah.
Is this my actual true self saying this to me, or is this my trauma self? So this is something that I definitely do with a lot of my clients as well, that it's a part of the trauma therapy as well, that you help them identify where is this coming from. Is this coming from a place of love? Or is this coming from a place of punishment? Are you trying to punish yourself when you're doing this? The difference between your actual self and your trauma self. So this is where we sit with them and we ask them that, what were your values and what were your beliefs before this event happened? And how do you feel now? So we can identify where is this coming from. And I would always ask this question that, when you hear that negative comment that you're making for yourself, or that negative concept that you have for yourself, whose voice is that? I will make them close their eyes and I would ask them this question very often, that whose voice is this? And Obviously,
able to
initially, no.
No, yeah.
Initially,
Takes a lot
they
of
won't even
digging.
ask that question. Like, they won't even understand that question initially. But then later, the more you do it, the more clarity they have, the more concept they have developed of what the effects of trauma really are. And that way, they'll be able to identify who that voice is. And they exactly know then where is this coming from. And now they know how to differentiate between those voices as well. So inner voice, the inner dialogue, it is very important. And what we need to do is we need to reparent the inner dialogue. A lot of times we have wounds from the childhood.
So, the inner dialogue you mentioned, right? So I guess that's very similar to self-concept. Would you agree? And I think self-concept is more than just how we view ourselves. It's more about how we view the world, the people around us. And I know you probably work a lot on self-concept. So how would you define self-concept? What is that for you? What does it mean to you?
So self-concept for me is basically just an image that we see in the mirror. I'm not saying that that's the actual image that you see, right? That's not the real actual image that you see in the mirror, but it's how you view yourself.
So the
it's your perception of who you are, basically.
Okay.
So I might be, for example, absolutely gorgeous, but if I don't see myself that way, if I don't think that I'm gorgeous, then that's my self-concept. So often what happens is that when you go through a childhood traumatic experience, the mechanism where you're working on defining yourself, where you're trying to explore this world, where you're trying to explore yourself, that gets affected.
Yeah.
So you're not being yourself, you're not being your natural self. As a child, we have some needs, right? And these are our basic needs. We have the need to explore this world. We have the need to be curious.
Yeah.
We have the need to feel all our emotions in the most natural capacity that we want. And if anything becomes a restriction in that will definitely have a very significant role in how you define yourselves later for your life as well, because your most basic needs and your most basic instincts have been restricted right there in the childhood, and you didn't get a natural capacity to grow out of those, to work on those. So definitely it does get affected.
Absolutely. And I think what you touched on there is about having those things happen to you, which is then what leads to the trauma that you carry with you. And I think what's interesting for me is that, and you can tell me if you agree with me or not, but I feel like not all trauma is obvious. So sometimes it's not about what's actually happened to you, but it's also what's not happened to you and what you've kind of lived without, if that makes sense. I guess, could you expand on that a little bit?
So like I said, trauma is not an event. When we talk about traumatic events, we're basically limiting the impact that a trauma can have. We can classify on the basis of a few events that we commonly see those themes out there. So that's not just what is causing the trauma. A lot of times, something very traumatic from that list can be absolutely okay, and a person can navigate that in a very healthy manner, and they can get out of it in a very healthy manner without having an effect. But then at the same time, something that might not classify in that list might leave a very traumatic effect on that person. Now, there's a lot that goes behind it. There's a lot of there's a lot that goes behind it. Like, for example, there's a range of tolerance that we have. We're basically born with that range of tolerance. Right. Now, what happens is that when you keep getting these traumatic events, the range of tolerance keeps getting low.
Smaller.
Right?
Yeah, of course.
So now when it's smaller, another event adding up to it, you might not be able to have that great of a coping mechanism for those events that are coming when you have a smaller range of tolerance. Okay. Right? So obviously when the smaller range of tolerance is there, you are not going to be able to handle that event in a very healthy manner.
Of course.
But when your range of tolerance is larger, of course, you might be able to navigate it better. So this is why we see the difference that two people of the same event might take that event in a very different way. Might take the effect in a very different way, which is why we say that it's not just about the event that happened,
but it's more about the tolerance and how much
it's more about how it impacted you in your life, right? How did it impact the other factors of your life?
So looking at the impact that you mentioned, I think that's really important. I read something recently and it spoke about how trauma can impact the brain and the hippocampus. So I think it begins to shrink the hippocampus, if that's correct, which also impacts the areas of learning and memory as well. Have you noticed that perhaps in the work that you do, because you're a trauma specialist?
So overall, if I just try to put it down into layman words, your executive functioning is basically affected.
Yes,
right?
Of course.
So your executive functioning is affected and comes from the cortex over here. So when your executive functioning is affected, all these things like decision making, planning, organizing, memories, emotions, they're all not working at their prime optimal level, right? They are affected and they are working at a lower level. Now, a lot of other things are also happening in your body when you go through trauma. So for example, there are some hormones that are being released in that situation. So your adrenaline glands are basically responsible for producing these hormones. And we've seen a lot of researches where we have seen that if you have higher adverse childhood experience, it's going to lead to chronic illnesses later in your life.
Can that be prevented?
So, yes.
Okay. Sorry to speak on
for
the
sure. For sure, it can be prevented, and it's a lot of work that we have to do.
Absolutely.
Because if I say that, like for example, if I say that trauma is the event, of course it's not preventable. We can't prevent an event.
No, of
course we can't
not.
stop an event. But when I say that it is the effect that it has created, that can definitely be prevented with a lot of validation, with a lot of support, with a lot of love, with the right kind of healing at the right time. That is happening in that moment, right? So definitely it can be prevented for it to become a larger something, right? So it's exactly just like that wound. So what we do basically is we put a Band-Aid on the wound, right? Because we just want to temporarily fix it. Right?
Short term.
And that's like a short term fix for ourselves. But what happens is that it does get infected. It keeps getting infected and it keeps growing. So what we need to do is we need to rip out the Band-Aid. That's going to hurt.
Of course.
Okay, of course it's going to hurt really bad. And you're going to have 10,000 thoughts before ripping that out. But you have to rip it out. And that's when the true healing is going to start for you. Definitely. It takes time, it takes work, but we can definitely prevent it. So it's like it's not a dead end if you've had a traumatic experience in your life. You can definitely work on yourself through those things.
Before we continue, let's take a moment to talk about mental well-being. At Openminds Centre, our dedicated team of professionals is here to support you, whether you are navigating stress, anxiety, relationship challenges, or personal growth. With expert psychiatrists, psychologists, and specialised therapists, we provide tailored care for adults, children, and families. From therapy sessions to mental health workshops, we're committed to helping you find balance and clarity. Openminds Centre is your space for healing and transformation. Book an appointment today and take the first step towards a healthier mind. Clear minds, healthy lives. Now, back to our conversation.
You're not going to get your basic needs. Like that's the association that you have in your mind. It can also stem from school. It can also stem from friends. There's a lot of bullying happening. You see that a lot in kids. There's a lot of bullying happening around them. Even if it's not the most classic traditional way of bullying that we see often. Like it's also about belonging. A lot of times they would perform in a certain way, the peer pressure to belong in a certain group. They will feel isolated, they will feel withdrawn if they don't act a certain way. So all of these things combined can, result into something that is called the fear of failure. And when you have that fear of failure, it will definitely affect everything. So one thing that I really like to do with when I'm working with kids is I play the game Jenga. I'm sure like everybody's...
I love Jenga, yeah.
It's an amazing game and I love how I can use it in so many different ways, right? So every time when I play the game Jenga with a timer on, they'll be panicked.
Right.
They'll be so panicked and they'll be like, oh.
It's that pressure of time, right?
Oh my God, It's the pressure of time and the pressure that they have to perform
well,
in a good way,
yes.
Right? So they will definitely fluster a lot when they're trying to play the game. And they'll probably end up breaking the tower very soon.
Very quickly, yeah.
But when there's no pressure,
right?
There's literally no pressure and I go like, okay, no time limit, let's just play. Okay, there's no reason why I'm doing it. So my kids now understand that there is going to be a metaphor in something. So they say it in the beginning. We know there's going to be a metaphor in this. So I always tell them, no, we're just playing.
Just
it's
playing,
nothing, absolutely. And then they would play the game, and the game would go forever.
Ever, yeah. I bet
Right?
the tower gets pretty high.
It's
then
pretty
with
high,
the
and I'm
timer.
most probably the one who's breaking the tower, right? So it definitely shows you a prime example of how you perform when there's no pressure there.
Yeah.
And you are your natural self. You're engaging into your abilities, you're engaging in your talents, you're engaging in your personality. All of those things combine, and it's very important for a child to engage into all these things.
Absolutely.
That basically develops your sense of self.
Yeah.
If you know about your personality, if you know about your skills, if you know about your talents, all these things together will shape up into the definition of who you are, basically.
For sure. Don't know if I'm going off topic a little bit, but that pressure, right? So that time being there, that time constraint. Do you not feel like that having certain pressures or having a timer, for example, can help you perform better?
A lot of times, yes.
Yeah. And the only reason I ask this is because I feel like I'm someone who performs well under pressure. You know, whilst I was doing my training to become a therapist, I feel like even in my undergraduate doing my dissertation, I did it in honestly 4 days, and it's just time pressure for me. Obviously, I panic, but I get my work done, and I get a pretty good result at the end. So yeah,
So
what do you think in terms of that?
So what happens is that a lot of times we are used to of performing under pressure.
Right. Okay.
Right?
As humans,
And-
I guess we are.
Yeah,
anyways,
and our
yeah.
brain works in a certain way that if you don't get that pressure, because maybe that's how you have experienced life.
Yeah.
Like there's a lot of pressure, there's a lot of authority that has been telling you that, okay, you are supposed to perform under this high pressure.
Okay.
And now your brain is wired into thinking
Very
that way.
interesting, that is,
So
yes.
you don't perform when you're not in your survival mode, right?
Yes,
So
yeah.
you only perform when you have to really, really, really do it. And for sure, it can be helpful for a lot of people. We've seen that a lot of people have found their own coping strategies, right?
Yeah,
And this
absolutely.
is like a self-coping strategy that you have
course.
developed for yourself, and you know that you perform under pressure well. But then at the same time, there needs to be a little bit of work done on that as well.
No,
Why are
absolutely.
we not able to
Yeah.
perform without pressure?
Yeah.
It's like, that's the question. But coming back to your question of timers can definitely be helpful. For example, if I'm working with a child with ADHD,
Yeah.
we have to learn to work with
course.
timers
Yes.
because that is going to help their attention. But then at the same time, we add in sensory breaks.
Yes.
So
which
we
is
can't,
important,
yeah,
it's
we
key.
can't teach someone to work under pressure without telling them that, oh, you're gonna get a break. You're
Of
gonna
course.
get, you're
Yes,
gonna
that's
get
important, isn't it?
a structured break. So they will only be able to perform for that 5 minutes that I've set the timer when they know that there's going to be a break after that. So you need to know that you're safe and you're comfortable after a little while. Only then you'll be able to perform well
At
under
your
that
best.
pressure.
Absolutely.
Right? So there's a lot
Going on.
basically
No, of course.
going on over there.
And I think it's important to kind of reiterate that we're all different and we're all unique. You know, we have different experiences, which is why we do things quite differently. So we've looked at fear of failure. The second kind of behavioural pattern I want to look at is fear of abandonment. Looking at the emotional walls versus the clinginess. Could you perhaps expand on that a little bit and maybe give us an example, if possible?
So mostly the way that I see these emotional walls building up is especially with kids.
Yes.
Like I've seen whenever they have tried to reach out to their parents, and for any reason the parent could not respond in the way that they expected the response to be. So that is usually the reason why the walls build up, because they're trying to protect themselves. They're trying to protect themselves from the vulnerability that they have felt in that, I would say, in that conversation.
Okay.
They're trying to protect themselves from the negative impact that they are experiencing out of that conversation, and they don't want to go through that again.
And that's
so now
when
there's a wall.
Right,
Right?
understood.
So that's your
understood.
protection mechanism.
Okay.
So there's withdrawal over there. What was the other one that you said? Okay. So clinginess would come when they see that the parent might go away for any reason, right? So for example, I see a lot of that, a lot of separation anxiety when the parents have been divorced.
Attachment figures, right?
Right?
So we have
Attachment
different types of-
figures.
Yeah.
So when one of the parent is not living in the same house anymore, so they will develop a lot of separation anxiety there,
Okay.
right? They would cling.
Yes.
They would have this fear that what if this parent also leaves me? Right?
Okay.
So that fear, it always comes from the place of fear that what if I'm left alone?
The
So
walls-
I need to
yeah.
cling even more. So whenever you feel like, for example, if I feel like I'm going to lose something, I'm going to hold on really tight to it. right?
Absolutely.
Just to make sure that it doesn't fall away.
It doesn't actually go away from
Yeah.
you. Yeah.
So when I'm holding it really tight, I would feel like I'm protecting it and I'm keeping it to myself. But what we don't realize it, that when we're holding it really tight, we're damaging what we're holding, right? We're damaging the relationship in that situation. And these are just some of those unhealthy ways, the coping strategies that I was talking about, some of the unhealthy coping strategies that a child would automatically manifest when they experience something traumatic in their life.
Absolutely. Very interesting, I think, that you said sometimes holding on can actually hurt us further. And I actually came across not a meme, but like something I saw on social media. It's of like a woman's hand holding onto a rope, and she's holding it so tight that when she opens her hand, there's a lot of redness there, some cuts on her hand, and that's a very interesting concept.
I would recommend this movie to my clients, and when I do recommend, they're like, oh, it's an animated movie and it's a kids movie. It's called Up.
Oh my God, I absolutely love it.
It's beautiful. Such a game changer to understand what letting go can actually do to you.
Yes, absolutely.
Right? Because when you have that load on you, you're taking the burden, and letting go can actually feel difficult.
Yes.
Right? And letting go would feel like, oh, you're just losing everything that you have held on to for such a long time.
Exactly that.
And sometimes it might be your entire life.
Yeah.
But then the minute you do it, you feel that it's not there anymore.
You kind of feel like you can almost breathe again, and like the weight has been kind of lifted. Absolutely. Just to add on to that, have you seen the movie Inside Out? And Inside Out 2 talks about the different, anxiety. I think anxiety comes on in Inside Out 2.
I think I love that movie more than any kid.
I agree. I think for all the kids out there, the parents out there, I would definitely recommend watching Inside Out 1 and 2.
To be honest,
for sure.
like as a psychologist, when I was watching it, it is such a smart movie.
It's beautifully scripted, amazing.
Way.
Yeah, to teach the younger generation of all these different emotions that we can have. And looking at the last behavioural pattern that I want to talk about, and I know this is such a popular topic within the current generation, is about feeling unworthy and settling for the toxic relationships. Can you speak a little bit about that?
It's such a vast topic. I mean, it's I can just go on and on about it because, again, like I said, it's nothing exists just on its own.
Of course.
Right? So what happens as a child, you receive the first definition of what love is, right? That's the first time that you're experiencing what love is, and that is mostly defined by your parents. That's the first relationship that you've had in your life. Now, if in that relationship, we are not able to find the right and good, healthy example of what love is, that would carry on for the rest of our lives with us. And because of that, what happens is that we do not feel that we deserve better and we deserve good because we don't have that good sense of self, right? The self-concept is low. The self-concept is not good. So when we don't like ourselves enough, then we don't think we deserve something good as well. And that will make you fall into something that is unhealthy in the first place. Now then, staying in that relationship and carrying on with that toxic relationship, that often comes with a level of comfort and dependency as well.
A bit of familiarity, I guess, right?
Is it because it's always scary to have something different.
Exactly
right?
that.
You're not okay with change. So after the traumatic incidents, you've been basically working yourself in a survival mode, right? Mm-hmm. So when you are in that survival mode, you're not going to think about what is healthy for you and what is not healthy for you.
One other thing that I think is really interesting is repetition compulsion. So why do people repeat the same painful patterns from their childhood? Why do you think that is?
Mm-hmm. It's familiar.
And that's it.
As simple as that. It's familiar.
Just used to it.
Your brain is working in a certain way, and the brain only knows how to function in that way. It doesn't know any other way to function it. Okay. So what you need to do is you need to change that function, and you need your brain to know that there are other ways for you to function as well. So obviously it's going to keep functioning in the same way. So for example, I watched this, it was a very random movie that I watched, and it had so much meaning that there was this guy who would just live in one room for all his life.
Okay.
Right? And he was only aware of eating in a certain way, talking in a certain way. There was just one room that he has experienced his entire life, and the minute he was out, he didn't know how to be in the world.
Yeah, because that's all he was used to, just being enclosed in those.
Or if we go back and we take the Plato's cave.
Yes.
The theory of Plato's cave, right? You've been living in the cave all your life, so for you that's normal now.
That is your norm. Yeah,
that is your normal.
Yeah.
So you don't know that the world outside of that cave is actually normal. So what happens is that the minute you get out of the cave, you want to come back to it. You want to come back to your old normal patterns because that's what the brain tells you. The brain tells you you're doing something abnormal. Abnormal is what? It's basically deviating from the patterns, right?
Deviating from what you know, I guess,
From
right?
what you know.
Yeah,
So
yeah.
your normal definition could be very different from the other world's definition of normal.
Yeah.
And that's the reason why, we see often people engaging into toxic relationships and staying in those toxic relationships for a long time in their lives.
Yes,
Right? They would stay in it despite of knowing that they know it's very harmful for them. They know it's toxic for them, but they will not be able to get out of it. Because that's where their brain comes in, and that's where the brain tells them that, this is what you know.
Carry on taking it.
Keep on taking it, because we don't know what's going to happen when you get out of it. So that is the fear of unknown that you
And that's
experience.
what anxiety is, right?
That's
It's
what
all about
anxiety
the
is.
unknown. Absolutely. Very, very interesting. So if someone's listening to our podcast and thinking, wow, this really, really sounds like me, what can they actually do to change their self-concept? I know you're going to say therapy, and that's absolutely fine, but what else can they do alongside therapy? And I guess if you can expand on how that can be really helpful, which is important.
See, despite of therapy.
Yes.
Sorry, let me scratch that. Okay. So even if you do have therapy, this is something that I always say to my clients, that therapy alone is never the reason why you are feeling better. It's a lot of work that you are also doing with yourself. Like, it's a lot of reflection that goes into the work of therapy. And therapy alone is not a magic pill.
No,
It's going to work for you.
I
I wish it was.
Well. It's not a magic wand. You're not going to be fixed.
Yeah.
Because I don't think they're broken to begin with.
Absolutely.
And that's really important.
Absolutely.
Isn't it?
All we're doing is we're just changing the way that they're thinking.
Yeah.
We're just giving them different reasons to think about. We're just giving different vocabulary to the brain to now function. Earlier, it was just functioning on a very limited vocabulary.
Yes.
That was coming from this critical inner dialogue that we were talking about.
Absolutely.
What we're doing now, we're expanding the vocabulary.
Yeah.
So the reflection and the work that you are doing to yourself, that is the most important one. And just be more open to challenge yourself towards just be more open to challenge yourselves towards situations that you feel like are very scary for you. Because those are usually the ones that will actually do the work. Those are actually the ones that will make you actually sit with your emotions and be vulnerable and actually do the work, because you can only heal if you're vulnerable.
Absolutely.
That's it. And vulnerable is, I know it has a negative connotation, right? The word has a negative connotation.
Does, yeah.
But I feel like it's the most important word. You will never work on your emotions. You will never work on yourself if you don't feel vulnerable.
You're right. Absolutely. And I think just to add on, I feel like healing isn't just about thinking differently. It's about creating the opportunity to experience new emotional experiences, right? Yeah, absolutely.
Being more open to all kinds of experiences.
Yeah.
And also being aware of the fact that you might have good ones, you might have bad ones, but at least you did experience. And you're not letting your past events dictate your present.
Absolutely.
Right? It definitely has an effect. You can't change the past event. You can definitely not remove the past event. But what you can, at that point, you didn't have any choice. Right?
Yes.
But you do have choices now.
Yeah,
you do have the
absolutely.
choice to work on the effect of what that past event is.
Yeah.
And that, I would say that empowerment really does the work. The minute that they know that now they have choices and now they can work on it. So that definitely does a lot of the healing on its own.
Absolutely. And I think what's really important is that the brain learns by experiences, not just insight, right? If you could share maybe one practical tip or technique, whether it's reframing thoughts or whatever it might be, for the audience to take away, of how they can maybe perhaps start the healing of the wound, what would it be?
The first thing I would say, the most important one, is to actually engage in your fear.
Yeah.
Right? Not suppress. So one thing that I like to do is I like to ask myself the question, so what? Not in a way that I'm trying to invalidate what happened, like, so what, that happened. No. Like, don't rationalize it. So what as a series of what keeps going and what is the final destination of your fear. So I would keep asking myself that till I reach the final point of what my fear is. So when I reach to the final destination of my fear, I would actually realize that, oh, it's actually not that scary. It's actually something that is very manageable. And even if it does happen, I have 10,000 ways to handle this situation. So that particular point will make me engage in my fear fully, and then I will be able to work on it. So the first thing and the most important thing is engage.
Engaging in that.
Engage.
And not suppressing.
If you want a healthy environment to engage that in, that would be good. Because a lot of times, if you're in a vulnerable environment, it's not very, I wouldn't advise to engage in your fear in that environment.
Of course.
But of course, with support, with having good friends around you, having good family members, your support system around you that can validate your emotions and support you and love you, that is definitely a place where you can find that path to actually engage with all your emotions.
Absolutely. I couldn't agree with you anymore. So it's important to not suppress. And the way I look at suppression and explain to my clients is that imagine you're in a swimming pool and you've got that, the bouncy floaty, and you push that ball down. So you're suppressing it for that moment. You're pushing it down in the pool. But the minute you let go, because you can't hold it there forever, right? Your arms start aching. Absolutely. The minute you let go, it just pops right back up again.
That's an amazing example. Can I borrow that?
Absolutely, of course you can take it. I just want to say thank you so much for, taking out your time to be on this podcast with me.
Thank you so much for having me. It was lovely talking.
You're very welcome, and I feel like I've learnt a lot. Thank you so much for being here, honestly. Really, really appreciated having you here. You're very welcome. If you found this podcast insightful or you enjoyed listening to it, don't forget to like, share and subscribe for further conversations on everything mental health related with our professionals. If you need support, Open Minds is always here for you. See you in the next episode.